We are here in Dallas, Texas. Over 100 days have passed since the Supreme Court reversed the constitutional right to an abortion.
Yes, and since then, it's, of course, been a hotly debated issue on the campaign trail. No one has been more affected than physicians and their patients. Let's bring in now Dr. Ashton. You've been keeping an eye on this, and really looks some alarming and, I guess, scary implications. We knew maybe some of this was coming.
Yeah, there are some significant ripple effects, and what we've heard so much about the political side of this abortion debate, not really so much about the risks that doctors and patients have subsequently been forced to take. The day Roe v. Wade was overturned by the Supreme Court was the day that many pregnant women in the United States woke up to fewer choices.
We knew from the second it happened that our lives, the way that we provided medical care, were going to change, and that our patients were going to be so much more desperate in the things that they would have to overcome to just get health care.
Since the Supreme Court's Dobbs abortion decision, at least 14 states have ceased nearly all abortion services, leaving patients to travel to one of 24 states, which allow abortion up to 22 weeks or beyond. While the U.S. has been dealing with the maternal mortality crisis for years, the impact of abortion becoming illegal in some states was felt instantaneously by doctors who take care of women. How quickly after that decision was announced did you start to see things change right here in this facility?
When Roe versus Wade was overturned last summer, we saw an additional 200% increase in patients coming from out of state.
In Texas, where nearly all abortions are illegal, this Planned Parenthood clinic is still trying to help patients as best they can.
We're providing all the other care that we've always provided: access to contraception, STI testing and treatment, breast and cervical cancer screenings, access to PrEP, primary care. There's actually more of a demand for those services given the landscape that people are navigating where they don't have access to abortion in many states.
And timing can make the difference between life and death for a woman with an undesired pregnancy who is seeking termination. How many patients in your clinical experience know the date of their last menstrual period or have had an ultrasound and can accurately date that pregnancy?
Some patients know exactly, and other patients have no idea. A lot of people have irregular menstrual cycles, and so they just don't know when they got pregnant. And of course, every week that goes by, it becomes more expensive, more challenging.
But time isn't the only critical factor in abortion care. It is also finances.
Imagine having to choose between paying rent and paying for your abortion. People are literally risking homelessness to get their health care.
It's lodging, it's transportation, it's paying for the care when they get there.
And the emotional or psychological toll on these women and their doctors is significant. Are there times where you run through a gamut of emotions yourself?
Abortion is just one type of health care, and I provide a lot of types of health care. And I think of them all the same way. It's a privilege to be able to take part in my patients' lives. It's a privilege to be able to be their counsel for them when they need medical information. It's not medical care or providing medical care that takes a toll on me. It's working within a system that provides for neither health care nor is it actually a system. It's the structural challenges that weigh on me the most.
And now, something that was previously inconceivable, a legal or criminal threat to doctors who treat women in states where abortion is illegal. Can you fathom what it would be like to risk criminal and legal consequences for doing your job as a physician?
No, it's so challenging. I mean, imagine being a doctor and having before you a patient with an ectopic pregnancy, and you're not even sure if you can provide a life-saving medical treatment. You're literally choosing between saving the life of your patient and going to jail.
And Dr. Ashton, something here that's you talk about now is timing. You have to, women have such particular timing now in trying to plan a trip and get out of state and balance it with their health. How does
So let me take you through that, you guys, because it's literally the clock starts ticking when a woman finds out she's pregnant.
Yeah.
Many women don't find out they're pregnant until 6, 7, 8 weeks because they have irregular periods or for a variety of other reasons. First trimester terminations go through the end of 12 weeks. Now when you start that clock and you start factoring in appointment time, travel time, getting off of work time, arranging changing childcare time. And then once that woman gets maybe to another state where she needs to do blood tests, ultrasound, that takes time to come back. And then the procedure, the clock is against that woman literally from the second she finds out. And that is going to affect women's lives for sure.
Dr. Ashton, we thank you as always.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.